Okay, let's talk about the cranial nerve 7, the facial nerve. Don't get it confused with the 5th cranial nerve. So, it is a mixed nerve. It enters the internal acoustic meatus of the temporal bone. And where does it exit? That's right, the stylomastoid foramen. And it is a motor nerve to the stapedius muscle, which is a muscle of the middle ear, which protects us from loud sounds. So we'll talk about the chorda tympani. This arises from the facial nerve and combines with the lingual nerve from V3. Sensory, it carries taste fibers from the anterior 2/3 of the tongue. And parasympathetic, it carries fibers to the sublingual and submandibular glands. How about the motor innervation to the face? The facial nerve is the sole motor supply to the muscles of facial expression, and there are 5 main branches: temporal, zygomatic, buccal, mandibular, and cervical. And these names refer to the areas they supply. So let's ask which muscle is responsible for smiling. This is the risorius. How about for wrinkling the forehead? Occipitofrontalis. How about for blowing out your cheeks? That is the buccinator and orbicularis oris. How about for flaring out the nose? That's the levator labis superior, a part of the nasalis. And how about for winking, closing one eye? That's the orbicularis oculi. So let's talk about clinical correlates. One which we often hear about is Bell's palsy. This is complete lesions of the facial nerve, which leads to facial paralysis. And this is from there's a loss of taste from the anterior 2/3 of the tongue on one side and decreased salivation. And where do we often see Bell's palsy? What disease? Lyme disease. Okay, thank you very much.